Hello everybody. We are here today and we are called Team Up for Hope Inc. And our mission statement is that we're an all volunteer 501c3 nonprofit organization that seeks to address the impact of mental illness, substance use, and suicide in our communities by raising funds and awareness for local nonprofit organizations at the forefront of these crises. My name is Amy Green, and we're here with a special guest, which you're about to meet. And without further ado, we have our Team Up for Hope president, Mr. Wayne Patterson. Take it away, Wayne.
Good morning. So thank you, Amy. And I have a very special guest today that's going to be sharing a wide variety of information. And I guess without further ado, I'll just introduce her name. It's Dr. Irina Wen. And before she gets started, I would like to give you a little background on Irina. Dr. Wen, I meant to say, she is a PhD in clinical psychology, and she also runs a practice that she founded called Touchtone Psychology several years ago with the goal of helping people thrive and enjoy meaningful and lasting relationships. It's close and dear to my heart. Her office specializes in couples therapy and trauma, and the goal is really to help people heal and find their way to a vibrant life and fulfilling relationships. So, welcome, Dr. Wen.
Thank you. Thank you. And so great to be here. I'm so excited to share, to connect with both of you and with the greater community, to be of
Yes, and
service.
it's great to have you here. I'm excited because I'm familiar with what you do. I'm familiar with your website, and I look forward to hearing all about how you got involved
Mm-hmm.
with this area of
Yeah.
expertise and some of your experiences through experiences and the strength and hope of clients that have come through, and I look forward to the whole team of Team Up for Hope being able to embrace what you're saying to bring further awareness to
Mm-hmm.
the community that we live in, as well as the world, because once it's on the World Wide Web, we all see it locally as well as throughout the world. So off you go with,
Yeah.
I guess, how you got started and
How I got
go
started,
from
I would sure I can share a little bit of my journey. So yes, I'm a clinical psychologist and I've been practicing for a while now. And my path has always centered on trauma, which is assessment, diagnosis, and treatment of trauma and post-traumatic stress disorder. So I started originally actually as a forensic psychologist working with incarcerated populations. And then I transitioned slowly to working a lot with military. So I ran a clinic at NYU, and now I'm still teaching and on faculty at NYU, where I oversee other clinicians. And now it's mostly, so I do a couple of things there, which is helping psychiatry residents at NYU to become more trauma informed clinicians. And also, I supervise and teach our psychology interns at the Military Family Center at NYU. And we work with military families and veterans of post 9/11 era mostly. And so I teach and support them in becoming more proficient in a particular model of working with relationships, which is very dear and near. That's my clinical home, so to speak, and that's called emotionally focused therapy. And I can talk about it a bit more. So over the years, I've transitioned to working with the military in research at NYU as a postdoc. I've done a couple of postdocs at Bellevue and then NYU. and then became primarily focused on clinical work and also teaching. I love teaching other clinicians in both trauma and trauma-informed care, as well as relationship care and direct clinical service. So that's, and now I'm primarily focused on building my mini center at Touchstone Psychology, and I also do quite a bit of teaching and supervising in the community.
Wow. That I could not repeat that. And I would say 90% of it just flew right over my head. But that's why you're here, to further clarify some of the stuff. And it's interesting because I think of relationships, not just, husband, wife, or partners, or I think of the world of relationships that exist today, and they vary in all capacities, but even friendships, even I guess collaborations of like the Team Up for Hope committee, where we have relationships.
Absolutely.
Right, that we so it's just not love relationships, but just relationships in general. And that's why I was so excited to have you speak with us, because I gathered that from what I read and from your website. Do you want to dive into the type of relationships that you're dealing with?
Sure, I can talk a little bit about that. I think, being a trauma therapist, but also in general, mental health provider, which we see in a lot of research, but also just common sense and the way we're wired in attachment science, we say we're wired to connect. We're bonding creatures. We're bonding mammals, right? So it's our strongest resource for us is our relationship. And that's, of course, starts as a baby. It starts with our caretakers. And then as we grow, that's adult relationship, which expands. And it's from many, maybe intimate relationship, of course, but also friendships, and then, wider rings into the community. As creatures, as species, for example, we don't have sharpest teeth, we don't have sharpest nails, but what we have is that we have our communities, we have our groups, tribes, so to speak. And that really what makes us evolve through, not always in the best way, as I think current day and age shows, but there are plenty of room to evolve more. But I think that is, if you look at, for example, even research on post-traumatic stress and trauma that I do a lot, is one of the biggest protective factor is social support. And it's a very kind of big term, but it can imply many things. But we know for a fact that isolation is the biggest enemy, I think, of mental health. And that's a lot of mental health problems stem precisely from that.
Wow. Before we go any further, those of you that are listening, I want you to go to Touchstone Psychology New York.com. That is Dr. Wen's website, and you'll see pretty much what she just finished discussing. And there are different links that you can go to get more information and get more aware of what she's talking about today on this webinar. And the relationships, when I think of relationships, of course, I immediately think of love relationships. And then I realized, with being in the position and leading Team Up for Hope, I realized every person I come in contact with, from the time I leave the love relationship from my home and go out with colleagues and service industry folk and just people that I even get my breakfast from. We have relationships, and that's that's everyone that we come in contact with in our lives.
Of course.
And when you talked about isolation, And let me further, is the isolation just being alone in your house, or elaborate on the isolation that you mentioned? Because
Yeah. Well, I think you're bringing up such a beautiful point that we exist in this web of relationships. And I think it's deeply meaningful for us. And isolation is not, it could be being alone in our house, but, I think we can distinguish between loneliness and solitude, for example, right? Isolation and solitude. There is a very healthy, beautiful, and nurturing space when we are by ourselves, with ourselves, in solitude. It's more maybe of a chosen space that perhaps a lot of us need to go and have deep contact with our own inner world. But isolation and loneliness is something else. I feel it's when we don't feel like we could share, we have a place, a safe place, an engaging place, an interested place to share ourselves. And so existing, and you're right, when we buy coffee or we interact with, someone else, or mailmen, for example, and so on, that is also, of course, relationships, but they may be, you know, they may not go as deep. They may not provide us with an opportunity to share the full depths of who we are, and they may not fully undo the isolation that we may feel, right? And of course, it's better. We always say, in mental health, when people feel very depressed, and part of the feature of depression is that we go inwards, energy decreases, we don't want to go out, but it becomes a cycle, right? The more you disengage from the world, the more disengaged you feel, the more depressed you feel. So, part of, for example, a lot of therapy approaches to depression is what we call behavioral activation, which helping people go out there, go to a coffee shop, go and engage with people. And I think that's a very big first step. But we also need deeper relationships, I think. And that's whether it's our intimate partners or friendships, somewhere we can really feel deeply seen.
right.
Hmm.
I'm glad, I'm glad you're bringing that up, because in the area that Amy and I are engaged with Team Up for Hope,
Hmm.
we focus with various aspects of mental health,
Okay.
and we also deal with addiction as well as suicide.
Sure.
And isolation is a term that we hear a lot in those areas, and it's not a positive. It's like, don't, if you're an alcoholic, don't go home and isolate yourself and
Don't
just keep
isolate
drinking,
yourself. Right,
you
right.
know, and or in your car or wherever you may isolate, or you sneak into the
Yeah,
basement, or
yeah.
or um, and the same thing with, if you're thinking of harming yourself and you isolate, and you start to overthink things, and you feel as though you're the only one in the world that feels this way,
Mhm,
and
mhm,
so that is just getting away from the world and your relationships,
mhm.
right?
Absolutely.
And I guess, yeah, so that's
Mhm.
what Amy and I have seen over the years with individuals that are sick and suffering, and
Mhm,
from
mhm,
professionals like yourself that have come up and
mhm,
spoke about
mhm,
it. I would like to elaborate a little bit more on the trauma. The word trauma just sounds,
mhm.
well, I you were talking about stages of development, and that's important, and I've learned that over the years as well.
Mhm.
But I'd like to hear a little bit more about the trauma, because I'm assuming the trauma happens during maybe some of these stages of development.
Of
And
course. Yeah.
I'll just let you roll with that.
Sure. Yes, I can talk a little bit about that, or a lot, depending on how much time we have. I teach a lot about trauma and kind of help people understand what we mean and what the paths of healing are as well. But trauma, when we talk about it, it's quite a widely used term right now. It seems like it became very popularized, and maybe,
Yes.
and some people say it's a good thing, some people say we overuse it. Um, but it's common, right? It's common, and it's now actually, maybe it's a good thing that we are becoming more aware of the effects of adverse experiences in life, and not, of course, not to neglect the resilience that we all have also, and we can overcome a lot as human beings, but we also need to acknowledge that the struggle. And so talking about this, the trauma or traumatic events, is a way to acknowledge that it can be difficult for people. When we talk about trauma, in my field, we sometimes can distinguish between small t and big T trauma. If you look, psychologists, psychiatrists, different mental health professionals, they use diagnostic statistical manual, right? DSM-5 currently we're on. And there it's kind of like a book that helps us navigate and put name to different symptoms or reactions and struggles that people can experience. And we have to remember that human experience, probably it's hard to capture it in those categories. I always, even as a clinician myself, approach it with that awareness that we cannot.
Can you
Yeah,
repeat the category? Can you repeat the categories again that you had just mentioned?
the name of the book, the name of the text,
Yes.
it's
Yeah.
it's called Diagnostic Statistical Manual,
Okay.
5th edition. It was from 2013. So it lists all types of known psychological, psychiatric diagnosis to date that we know of. And again, I'm mentioning it only to say that in that book we define trauma in a very specific way. To then see, and then based on that definition, we also then potentially assess for and diagnose post-traumatic stress, PTSD, post-traumatic stress disorder. And according to the DSM, the trauma is defined as exposure to something that's death-threatening, or life-threatening, rather, serious injury or sexual violence, whether it's direct exposure or maybe witnessing, as that occurs to others. And that's something that, as we go through this current period, we're all witnessing quite a lot of trauma these days. So I think that's something for us to remember, that, even if we begin experiencing some reactions to what we're witnessing, that could be quite normal post-traumatic reactions too. Or it's also about repetitive exposure to aversive details of traumatic events. So, for example, police officers who respond to certain violent crimes, right? Or first responders collecting human remains or something like that. So these are kind of events that may seem outside the range of normal human functioning, but what we also know that they're not that uncommon. Studies show that about 90% of the population experience at least one event that would qualify as a traumatic event, according to that definition. So that's a lot. Not everyone develops PTSD. Not everyone then becomes depressed, clinically depressed, and can't function or develop substance abuse problems or something like that. But it's quite common on average.
Wow.
But it shakes up the system. It's uncommon in terms of it becomes overwhelming for our nervous system, for all our system, mind, body, right, nervous and neurobiological functioning. It's a lot to hold. And especially, I think it's much more toxic when the events that are traumatic are repeated, chronic, and severe. And then in those cases, we talk not just about PTSD or post-traumatic stress disorder, but we call that complex PTSD, CPTSD.
Wow.
That people can develop as well. I
Wow.
said a lot, so you
Wow. No,
interrupt
and
me.
I'm like, I want you just to keep on talking, but because I hear trauma
Yeah.
as well. And, like a traumatic event, that's why somebody's harming themselves. Traumatic
Mhm.
event, that's why they're
Sure.
drinking a lot. Traumatic event, that's
Yeah.
why they're thinking of, committing suicide
Yeah.
or using a substance, or
Yes.
that's why they're acting out. And that's why, so and trauma is always the term that's used to
Mhm.
explain why somebody is doing what they're doing. But it's also interesting to know that we have had traumatic events, all of us, in all of our lives, and it doesn't take us to that level of wanting to harm ourselves or drink or take
Yeah.
a substance.
Yes.
So there is something that does cause an individual to cross the line, so to speak.
Mhm. Mhm.
And you can talk about that a little bit.
Sure. Sure. Yes. That's
Oh,
brilliant observation that most. Can you hear me okay?
I saw that Amy had a question. You want to
Ah,
go with your question, Amy?
So yes, Irene, I did have a question. And as I was thinking of it, Wayne was speaking about it, and my question was, in like suicide, basically, I guess, suicide question. Do you see like one main common thing that they all have in common? Is it trauma? Is it depression? Like, or isn't there one?
there is no one, I think.
There is
There's
not one common thing. Like, so someone who commits suicide may not be depressed.
Well, depends on what you mean by depression. Do they meet the criteria for a particular diagnosis of depression? There probably some depression present. Are they all diagnosed with major depressive disorder? Probably not, I would say, or dysthymia. There's different kind of ways. Do they feel really down and have a negative sort of perception, perhaps, of themselves or the world? Probably so, right? Is it because they're depressed? You know, I'm a clinical psychologist. I was trained to diagnose and to do thorough assessment and all of that. And I'm also over the years have been on this journey of shedding labels in some way, because I feel like human experience is so complex, and there's such range that even applying the word depression, I'm always wondering, what does that mean? When a client comes to me and says, I'm anxious or I have a depression, I don't know what that means for that particular person. So I think, and for me, it's more about really understanding the uniqueness of their experience. So probably, yes, depression is certainly one of the big risk factors. So is
Right.
isolation, so is substance abuse, so is trauma. So there are a lot of different risk factors that
Yeah.
contribute to increased suicidal risk, for sure.
Let's run with that, because I'm
Yeah.
glad you asked that question, Amy, and I'm glad you're elaborating, Dr. Wen. But when there's this documentary that's out now,
Mm-hmm.
as you're
Mm-hmm.
all aware, called Anxious Nation, and it's focusing on our youth that are just very anxious and
Mm-hmm.
very depressed for multiple reasons. COVID didn't help, and of course, social media and instant information. It's just overwhelming. Um, but that that anxiousness and depression is not just focused on youth. That's what the Anxious Nation is focusing on, but it's all of us,
Mm-hmm.
getting overwhelmed in a new job, or a purchase of a home, which, we're very familiar with that, or the purchase of a car, or a death in the family. We could just go on and on. Dr. Wen, and I'm sure you see all of this,
Mm-hmm.
but I want to take that to this the step before it gets really horrible in the individual's life. And are there signs that we can see, your clinical,
Mm-hmm.
signs, because I could talk about signs from now until the cows come home on what I see, but clinical signs that will have us or help us, say, okay, there's something not right here with
Mm-hmm.
our loved one or our coworker,
Yeah.
or whatever.
Um, well, if we talk about suicide thoughts, right, and suicidality, if that's what you mean by getting really bad, there are several signs we're definitely looking for, and um, signs of depression, maybe withdrawing into from the world more, self-isolating, low mood, right? Not the difficulty engaging. That can be certainly signs we'll want to look for. Hopelessness, Amy, you asked about one particular feature. That's certainly a very dangerous one when there's expressed hopelessness, that there's no other way. Um, and if we specifically talk about suicidality, we also look for signs such as preparation of will and concrete steps. I mean, that's when we're really going into,
Mm,
well, will, we all should have maybe like thoughtful about will and so on. But if people are gathering belongings and kind of going through in a very um, unexpected way, all of a sudden, that can be a dangerous sign as well. That there is something that, maybe there's a plan.
right.
When we talk about suicidality in general, I mean, thoughts of death are not uncommon for people, right? We're mortals. And we, during periods of our lives, could feel down. And passive thoughts of death, such as, can't deal with it anymore, I wish I was dead, we're dead. That's not necessarily an uncommon thought. It could happen to people. Not everyone will act on it. But when people start talking about specific plan, for example, consider a
Right.
specific plan, an intention, or means to do it, then absolutely that's when we walk into a territory where when we need to act more maybe actively.
Right. I'm glad and I remember your first sentence for this webinar. You said some things are just commonsensical, you know,
Hmm.
and right. And I just have to give you an example, with my daughters. I had them at the house a couple of years ago,
Okay.
and I was starting to give them pictures, like physical pictures from the old days. And so it was a day where I had all of these photos, and I had them come by, and I wanted to give them the photos, so that they can have them,
Uh-huh.
because, I'm not that I'm healthy. I hope to
Right,
be
right.
around for many, many
Absolutely.
years. But even as I was doing it, my daughters were saying, is there something we should know about? Why are you giving us these
Right,
photos?
right.
So their common sense was like,
What's going on
is
here?
there something that we don't know about? So it had them
Yeah,
questioning,
yeah.
right? Which was, it was keen on their end to kind of put the two together. But I didn't think that was where I was
You
going.
alerted them.
I know I wasn't going there with that.
Right, right,
I just
right.
wanted to get all the pictures out of my house
Yeah,
and give it to them. And they, because your children, they become the monarchs of the family at some point, and then they have all the photos, and of course we were
totally.
taking pictures of them, but digitally, and it was a fun day. But it's something that alerted them. So, and that's what you're talking about when I start
Yes.
putting together
Gathering
unexpectedly. And
belongings.
I was unexpected. And I just said, come on, let's go through these photos. So it wasn't,
Hmm.
something that we had discussed prior. So it
Hmm.
even caught their attention.
Hmm.
So, Dr. Wen, I know exactly what you're talking about when you bring up
Absolutely.
unexpected things within a family. The family should be.
Yeah.
Um,
Well, and if we're on this topic now, that we could, there are certain signs that may or may not be present, and sometimes families really struggle and have a lot of guilt about how did I not know, how did I not see if something really bad happens, right? If there is a death in the family that's self-inflicted, and there is no way to know for sure, and it's a really hard. It's kind of for surviving families to, that's trauma for sure, to make meaning of and to live through. So that's, we can never ever probably with anything predict anything with 100% certainty. We can do our
Yeah.
best.
Yeah. I have, since we've kind of went down this road on suicide for the moment,
Mm-hmm.
I've known a number of people in my life that have died by their own hand,
Mm-hmm.
and by suicide, and some, I would say all of them that I knew, it was a
Mm-hmm.
shock to me,
Exactly.
and
Right.
I didn't know, but I didn't
You
even,
didn't know.
I wouldn't have even known what to look for because I wasn't with them every day. They weren't
Mm-hmm.
in my, like, I saw them
Mm-hmm.
enough, but I didn't see anything that was
Mm-hmm.
off, so to speak, for me to think
Mm-hmm.
that they would harm themselves. Yet the families of some of the victims, they were engaged with,
Mm-hmm.
and some of them were going to therapy, and the families knew these individuals had a dark side, and they were
Mm-hmm.
going to therapy. They were on medication. They
Mm-hmm.
were living a positive,
Mm-hmm.
and contributing to society, because that's where I saw them, and in my business or interact with some other community service organizations.
Mm-hmm.
And so they were contributing, they seemed to be getting the love from the household. They were going to therapy, they were coming to see you, they were,
Mm-hmm.
and so medication, seeing you, loving household, engage with
Yeah.
society, not isolating, and then they still
Mm-hmm.
died by their own hand,
Mm-hmm.
right?
Mm-hmm.
So that has me scratch my head,
Mm-hmm.
right? About, then
There's
can,
something internal that was unresolved, right? Despite
yeah,
a lot of
yeah.
resources and support.
Even if you think you're doing the right thing as a family member, and the person is being transparent and
Yeah.
saying to you that I'm not okay, and you're driving them to therapy, you're making sure they're taking their meds,
Mhm,
you're
mhm,
seeing them engaged in the family, the family, the household family,
mhm.
seeing them engaged in the community. It's, how do you have hope?
Well, you don't know. I think it's in some families, hopefully, all those good efforts um, will be enough of a buffer, and in some, there is some sort of internal unresolved. I don't know this particular cases you're
Yeah,
talking
I
about.
know. Yeah, and right. So you would know if they were sitting in your office what was solved and not solved. So you as, or hopefully you would as the
Sometimes even for a
therapist.
therapist. I mean, I've
Yeah,
had situations where there was a, either in our clinic or some colleagues, there was a suicide, and despite the best efforts, despite the very good efforts to create a safety plan and monitor and watch for signs, again, we cannot
yeah.
100% prevent or predict everything.
It's 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 it hurts my heart,
Yeah,
you know,
yeah,
as especially as the leading team up for hope, and
for
going out
sure.
there and trying to bring awareness. And we have these efforts in our community we have these lawn signs that are out there, you know,
Right. Yes.
that
Yes. I
are
saw.
that are that are sharing positive messages, and showing the 988 number, which is the national crisis
Mhm.
lifeline number, and just little stuff that we care, we love you, you're not
I
alone.
think that's a beautiful gesture because it, in a way, it shows, it kind of, the message is, we see you, you're not alone. And I think that's the, again, like I said, because I'm a relational and relationship therapist, right? And even when I work a lot with couples who experience trauma, kind of trauma informed couples therapy that I do. But the model that I teach and I practice is very relational. So it's all about honoring our deep need for connection. And again, like isolation is, like we said, the disconnection that we may feel from society, from our culture, from our loved ones, from the lack of loved ones, whatever it is, from families, right? There are different stories that can contribute to that, but that's definitely very toxic for our mental health. And like in my line of work, we often say, pain has to be relational. It cannot be just kept inside. And so with my couples, when I sit, part of the work that we do is to help them connect with their internal experience and then share it in a softer, more vulnerable way. Whatever those fears, unmet attachment needs, or pain or hurts that are inside that often bubble up as some reactions, such as anger or something else. But in the office, we help them really kind of befriend their inner world in a different way and then share it and share it. And from that sharing, what grows is a sense of security and safety in the relationship and deeper bond.
Right. Right. And with that, and I could see that that sharing would not only enhance the relationship, but if there was the chance of the partner going to alcohol or going to substance use, or it it would be it would be something that's probably communicated, right? You would hope, right? If they're closer and they're being trying to be transparent with
Yeah.
someone that they love,
People
right?
often go, I feel, for substances or alcohol as a way of self-soothing, right? Self-soothing their pain, self-soothing their whatever turmoil that may be going on. Aside from the physiological aspect, of course, and the physical aspect that can develop through prolonged drinking or using a substance. But I think a lot of times it's to deal with whatever this kind of global general term pain may be.
Right.
And so coming to a partner is doing the opposite of that, right? Is not to withdraw into this relationship with a substance themselves soothed, but it's going to a person who may be a safe place for you
Right.
and help you regulate those feelings and sort through the inner turmoil.
And they are your substance. They are your alcohol.
In a
They are
way,
your,
yeah.
they
Yeah.
are, yes, yes. That would be wonderful. Oh my,
That's the oftentimes, yes, the goal.
you had talked about early on too, you mentioned tribe.
Yeah.
Yeah, elaborate on that a little bit.
Yeah, well, I talked kind of again, I use that word as a substitute for community, but I think it's to highlight maybe tribe. There's something a little bit more primal that captures our more primal longing for belonging, for connection, for having our people, right? The one with who we feel safe, for example, in the world.
Yes, yes. And it's it's kind of, yeah, it's like you've heard that term, it takes a village.
Yes,
And
you can use
and
that word
that's,
too. Village,
what's
tribe,
that?
community, tribe, community, village, all of
Yes,
that. Yeah.
yes, yes, yes. So when you said tribe, I immediately thought of it takes a village,
Mhm.
and I use that phrase frequently, especially in the community that we live in, because it's 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 small enough for everybody to kind of know one another in
Yes.
passing, right?
Yeah.
So we live in this community that when my wife and I first moved up here, we didn't know anyone.
Uh-huh.
And we were driving in the car and people were like waving. And I would wave back and say, "Hey, how are you?" My wife said, "Oh, when did you meet them?" And I said, "I have no idea who they are. They waved at me, I waved back, and it was just a friendly,
Yeah.
caring, kind gesture,
Hmm.
right? And it still exists
No,
to
it
this
still exists. We
day.
feel the same when we moved here a few years ago. It's a very similar experience to what you described.
Yes. So, and we're talking about, Warwick, New York. So if you're trying to, so if
Yes,
you want to drive around and have people waving at you, come visit us here in Warwick, New York.
exactly.
It's a beautiful community, full of compassion and kind, and caring individuals.
Mhm.
So then, that versus New York City, because I lived there at one time, and I know you live there as well, and
Yeah, yeah,
there are millions of people. You'll never see that same person again, right, in your life, and a different attitude, unless
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 something bad happens and the New
and
Yorkers
there
come
you
together.
go. That's where I
There
was
is that
heading with
spirit
this.
too. Mm-hmm.
That's exactly where I was heading.
Mm-hmm.
The tribe comes together, even in New
Mm-hmm.
York City. And of course, the most horrible, traumatic event we had there was
Mm-hmm.
9/11.
Sure.
And I was working there then. And it amazed me
Mm-hmm.
how the people, you know, became more compassionate and kind and opened up their arms and their restaurants
Yeah,
and
yeah,
their stores and their homes to
yeah,
everybody. And it
yeah,
was it was a sight to see. The
yeah.
the 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 back to the trauma part, and the talk a little bit more about that with the relationships, because and just the general relationships that we have with, like I have with Amy. Amy's a committee member with Team Up for Hope, and we get together and we go to events and we have tables and we share information and we present checks and we
Lovely.
follow ups. We do all these different things. Not
Mm-hmm.
sure, but there's a team of us. But I'm using Amy because she's right here in our face. But we have a relationship,
Of course. Yeah.
and
Yeah.
and
Oh, you have a beautiful relationship.
oh, we do. It's wonderful. And even in the background, we have our technical specialist. She's back there listening.
Right.
She's not a part of the webinar, but Jane, and she's a wonderful human being, and we have a relationship with her. And we have team members, so many team members that we have relationships with. How can we, I guess, better, and I'm not sure what I'm going to ask, but if there's trauma that happens in my life, how can we help? How
Mm-hmm.
can we help? And it's a rhetorical question, because I know if there's something happens, we should just be listening instead of speaking,
Mm-hmm.
right?
I
But
think you're asking actually a beautiful question. I don't know if I'm hearing it and my mind goes, because what I'm hearing, the way you set up Team Up for Hope is this little kind of mini family where you all come together and you do beautiful mission driven work, and it's based on humanity, right? It's not based on some capitalistic values where you're only valued for your, I don't know, efficiency and productivity. There will be no space for your trauma, of course not. You're, out of the conveyor or whatever, out of the commission, and then
right,
come back when you feel better. But I think if we build our communities and organizations, agencies, and I really want to hope that's the future, on through the lens of humanity, through the lens of anti-oppression, for example, right? Through the lens of allowing ourselves to be humans and uh, play a role, then there could be a lot of room to attend to if something bad happens to one of the team member, just like if something bad happens to a family member,
Right.
We mobilize, we shift roles, we take care, right? If something happens to a hand, like is in a body, full body, then we apply certain medicine and so on. So it's the same. So the body, full body can function again. Yeah, so I think it's kind of you talking about more humanistic way of building teams and organizations, which I really want to hope that one day we'll get to. And I see more and more examples of that, but certainly plenty of the opposite as well.
Yeah. I'm, you hit it right on the head. It's just being human beings and caring human
Mm-hmm.
beings.
Mm-hmm.
Um, and it's what we do. We volunteer. There's,
Mm-hmm.
these non-for-profit 501c3s are people get together, they believe in a mission and a vision, and they volunteer their time and their blood, sweat, and tears, so to speak, to a cause that they believe in, that's close and dear to their heart, and they have a passion for it. And I guess what I want to say on that, we're looking outward.
Mm-hmm.
We're looking at the organizations. We're looking at those organizations that are on the front line to bring awareness. Like you're on the front line. You have an
Mm-hmm.
organization where you're
Mm-hmm.
dealing directly with folks that need your support. And
Mm-hmm.
we're here to bring awareness that you are available to
Mm-hmm.
provide that support,
Mm-hmm.
right?
Mm-hmm.
So that's what we do. But
Beautiful.
that's us looking outward,
Yes.
right? And I think, and I'm saying this to the team because they'll be seeing this and hearing this, and I'm saying it to all the listeners out there that are engaged with all these community service organizations that are looking outward. They're either picking up garbage, or they're raising funds, or they're, painting churches, or they're doing whatever they do to help those folks on the front line. But we need to look inward. These same individuals need to look inward because, that saying, when you're on the airplane and the oxygen masks drop, you
Mm-hmm.
got to put that oxygen on you first, because you
Mm-hmm.
can't help anybody
Mm-hmm.
if you're not able to breathe oxygen. And so you see where I'm heading with this,
Yeah.
and that's where I guess you come in, and I guess with your final words for us today, how do we better, look inward, because we think we're doing a great job looking outward, but how do we
Hmm.
kind of do a better
Well,
job
I think it's
in?
maybe your team up for hope. These are individuals, right? Beautiful people who are coming together and dedicating a lot of their time to take care of others or serve as a bridge. And so, kind of inherently, you're a caretaker. I have that part too. A lot of therapists do, right? And so, always providing that nurturance for others. Unfortunately, sometimes it comes with the territory that it's not.
Right.
We're not very good at filling our own cup, and that's
Right.
and it
Right.
is so important to do, right? It's so important to do because ultimately, and again, I frame a lot of things in my mind through this idea of relationships. It's not just relationship with the outside world. I think the deeper we have the relationship with ourselves too, it allows us to extend ourselves deeper into others as well. But for that, we do have to pause and actually tune in and to see how depleted we feel, how much resource we have on any given day, and to honor that, I think,
Mm.
and to take steps to maybe replenish or take care. This big general term self-care that became so general that no one knows what it means anymore. But it's not just Medicare, pedicure, right?
Right.
It's so much more
Right. Right.
than that. That's And we all have to think about these practices or moments and spaces where we can really tune into ourselves in the same way and
Wow.
honor that inner experience too, and then give more back to the world. It's kind of a constant exchange. But if this part is neglected, then I think our work in the world also can suffer.
I want to thank you so much for uh, not only spending time with us today, but getting educated, and you getting information to be
Yeah.
able to do what you do from
Thank
day to
you.
day to
Mhm.
help those that need you in their lives. And I'm loving what Amy's
I
doing
know.
with she had your, and Amy, show the website
I
again
don't know how she
if
did
you
that. That
can.
was so cool.
If you could bring that up again, the website, because I'd like for you to see it. I will say it, but Amy actually had it live on her screen. It's Touchstone Psychology New York .com.
Hmm.
Yes,
That's right.
and there it is. And
Thank
that's
you. Thanks for
and make a
sharing it.
note of that, everyone, please. And you can go as a single. She does
Mhm.
couples and
Yes,
she does
I do
relationships. But
both.
remember, the relationships are with the world. It's not always just with
That's right.
couples.
And I'm expanding now, so it's not just me, which I'm very, very happy about. There's this
Yes.
expansion and growth that's happening
And
for
I
me.
saw
We're
that, and
happy.
I
Yeah.
saw that on the website as well. You go to that website, you're going to say, "Wow, all this stuff," and and I'm also going to give Amy, um, I'm going to give you Dr. Wen's phone number, so you could plop that up
Okay.
on the screen too. And it's 434.
Oh, well, let's do the other one
The
actually.
other
Or,
one, okay, then you give,
yeah,
please.
that's
Yes.
even better because sometimes this one is hard to attend to.
Okay.
I'll do the one that's for sure will be answered. So
Yes.
What one is that, Irina? 201?
201, yes.
Okay.
And then what's the rest of it?
777-1807. Because I want to make sure people definitely get responded to.
Okay. So there you go. You have Dr. Wen's phone number. You have
And
her.
on the website, if people need support, they can fill out a contact form, and that's always easy.
Yes. Yes. Just surely go and visit that site and Touchstone Psychology New York.com,
Mhm.
or give her a call on the phone number. And the email address is the Gmail address.
Yeah, that's perfect.
One, it's Irina Wen, PhD at gmail.com.
That's right. Here
There
it
it is.
is.
You got a phone number, you got a website, you have
Thank
an
you. You got it
email
all covered.
address. You can surely reach out and continue these conversations with Dr. Wen. I'm sure she'd love to speak with you. And don't forget that we, Team Up for Hope, are a resource as well for you to come to, and we can direct you to, if for some reason you didn't, see the times that we put up the phone number and the website, and we're teamupforhope.org. And it was truly my pleasure having you today, Amy, and Amy. It was truly a pleasure, Dr. Wen, having you with us and sharing what you do from day to day and how you're helping in this area that has really taken off by a storm. Mental health issues and importance has skyrocketed.
Yeah,
And I'm sure you're busy, and that's why you're even
that's
expanding,
right.
because people are reaching out. And I'm glad that they're reaching out.
Yeah.
And never forget, there is a 988 number if you're in serious crisis and you can't speak because you're really just really that far that you need some support. Do that. Jane I thank you again for the technical part of this webinar, and we look forward to doing this again in the future. So join us. And yes, it was a wonderful, wonderful time and great information. And I hope the viewers got something out of it as well.
Thank you so much. Thank you so much.
Thank you for having me.
It's been an honor to meet you, and thank you for sharing all of your expertise and your knowledge, so that if there's anything new we can learn, we can execute on it and try and help others. So thank you.
Thank you for having me. It's been a true
You're
pleasure.
very welcome. As the days and the weeks and the months and the years go by, things are going to be changing, because we live in this changing world. So, don't be surprised I ask you to come back and join us again.
Oh, absolutely. Yeah, anytime. Anytime.
Awesome. Listen, peace and love to everybody. Have a great one.
Thank you again. Thank
See
you.
you again soon.
Have a good day. Bye.
Thank you. Bye-bye.